And Sugar Talk brought to you by Diabetes and Endocrinology Consultants online at beachdoctor.com. And Dr. Lucas is in the house with us. Good morning, Doctor. How are you?
Good morning. I'm great.
All right. What are we talking about today?
What comes before diabetes? So rehearsing for diabetes.
Rehearsing. This is the trailer, the preview.
The preview
Yeah.
of coming attractions.
All right. So what does that mean? Is this trying to screen out people that are most at risk for diabetes?
Yeah, what you'd like to do is find people that are going to get diabetes and keep them from getting it.
Mm-hmm.
So that's sort of the goal, now that we have some definitions of what prediabetes is and insulin resistance. But the first thing is you have to have family history of type 2, so
Mm-hmm.
that comes before anything. Then you inherit being insulin resistant, and that means that your body can't use insulin properly, so that you have to make a lot of insulin to keep the blood sugar normal. So in this phase, the blood sugar stays normal, but you make a lot of insulin. Insulin makes you hungry, makes you gain weight in the middle of your body, makes you crave carbohydrates. Yes.
So you're headed towards that cycle.
Yes, so high insulin creates a lot of problems. After a while, though, your pancreas can't keep making all that insulin. It's just like if your heart beat 200 beats a minute, it wouldn't last as long as a heart that beats 70. So this pancreas is making, 3 to 5 times more insulin than normal, and it can't keep up the production, so it slacks off. And when it slacks off, the blood sugar creeps up. So normal blood sugar fasting is really under 90. If you start having a blood sugar fasting, that means without eating overnight, if you start having a blood sugar of 100 or more, then that's abnormal. Now, it may not be that abnormal, but it's a sign that something's going on that you need to take care of and keep it from getting worse.
So you mentioned first the family history. So are you not likely to catch somebody as pre-diabetic unless they had family history of it?
You can go by the lab work. So the two labs, the lab tests that are important would be fasting blood sugar over 100 or between 100 and 125, and the A1C, which is that average blood sugar test, of 5.7 to 6.4. So diabetes is defined as an A1C of 6.5 or more when you first diagnose it. Now, if your A1C goes below 6.5, it's not that you don't have diabetes anymore. It's just better controlled. So normal A1C is really 5 or less. So we're giving them a range here. But if it starts creeping up like that, it's a warning sign that you may be going to get diabetes later.
But if you don't have that family history, though, are you likely to have the test even run for that? I mean, are doctors going to recommend that if you're overweight?
Well, the fasting blood sugar test is usually, it's in a blood chemistry. So usually if you've got the routine blood work, then you usually get a fasting blood sugar. You may or may not get an A1C. A1Cs sort of depend on if it's in a panel or not, if it's in that blood panel that you have. A lot of them are now, and they're picking up people earlier and earlier.
Okay, and then, as you said, if you can get them earlier, then you may be able to stave it off. Right?
Yeah, because your pancreas hasn't worn out yet. It's still making, it's trying to wear out, but you're going to keep it from wearing out.
You're working on it. It's working
You're
hard.
trying to help.
Yeah.
I mean, we don't know for sure that's going to help, if anything we do now is going to help, but at least we can keep the blood sugar really well controlled if you know it early.
Okay. All right. So, again, those are some, are there treatments, though, or that people may undergo for prediabetes?
Well, we usually use metformin. The American Diabetes Association even recommends that. If you find somebody that has prediabetes, metformin helps your body use insulin better. So it corrects the genetic defect and improves insulin resistance. So metformin is usually the choice. There's some other medications that are not approved. There's no other medicines approved for prediabetes. And metformin is not even approved for prediabetes, but it's been recommended to use that. And of course, a diet and exercise thing.
Right.
If you know you're wearing out your pancreas every time you drink sweet tea, then you probably should drink something else.
Somebody in line right now should be having some second thoughts about what they're ordering.
Yes, and realizing, of course, that if you make a lot of insulin, you're going to crave sugar. And as you crave sugar, what happens is you'll eat the sugar, you'll feel good that you ate it, maybe. And then later, your sugar could drop because your insulin's not being released at the right time. So not only the pancreas makes too much insulin, but sometimes it makes it at the wrong time, and you have these ups and downs in your blood sugar. and you feel hungry again very quickly after eating. So a couple hours later, you might feel shaky, hungry, have to have something or you'll kill somebody type hunger. So you go and that's the problem. Like people that eat cereal in the morning, cold cereal, 2 hours later, they're going to kill somebody for food. So if they have a problem with your blood sugar, the cereal sets it off and it makes you hungry the rest of the day. That's why cereal and there's some other things, pancakes and waffles and donuts and
all
things.
typical breakfast food.
They're all starches, so they make you make a lot of insulin. You may make a little bit late, and then it drops your sugar too much. So if you feel that way after breakfast, then you may have a blood sugar problem. So we need to have it found out about.
Now, is that a typical symptom that somebody would have? I mean, are there other symptoms that somebody might go through?
Well, being sleepy after eating is one. That's called a food coma. If you go into a food coma, and everybody thinks it's just because they ate too much. But I don't think if you ate too much, like too much proteins and salad, I don't think you would have it. So it's really more starches. If you look back at what meals cause it, usually in the evening or a big lunch. Usually breakfast doesn't cause people to be sleepy because it's not that big. But if you get sleepy after eating, if you're shaky before you eat again, if you crave carbohydrates, if you can't tolerate carbohydrates, so if you eat spaghetti and you just feel sleepy or tired or flushed.
So the unlimited pasta bowl at lunch is probably not a good idea?
No, especially since everybody gets sleepy after lunch anyway, and you eat some starches, and maybe that's going to make it worse. So any of those symptoms, plus if you know your parents or grandparents had diabetes. Now, it may not be your parents necessarily because maybe they haven't been diagnosed yet, but looking back at grandparents, aunts and uncles, people that have more weight in the middle of their body.
If you have a brother or sister who's been diagnosed.
For sure. If you have a brother and sister, if you're starting to gain weight in the middle, even if you're normal weight, but your waistline is expanding or where your belly fat is, if that's getting bigger for no obvious reason, usually at menopause it gets bigger, different times, of your life it might get bigger. But if you're craving starches or sugars and your waistline's getting bigger, you feel shaky if you don't eat, then that could be a sign that you have prediabetes or some kind of version of that.
Okay, so prediabetes numbers, then just by the numbers, what's prediabetes?
So the numbers are the fasting blood sugar of 100 to 125, and then any blood sugar after that, if you did a glucose tolerance test, or if you just ate something between 140 and 199 anytime. And then the A1C test, which measures the average sugar over 3 months, has to be over 5.6, so it's 5.7 to 6.4.
Okay.
So those are the numbers you go by. So if your doctor does an A1C and it's 6, then that's going to be more risky than a 5.7. The higher it is, the closer you are to getting diabetes.
We're on Sugar Talk with Dr. K. Jean Lucas from Diabetes and Endocrinology Consultants. And we've been talking about prediabetes and some of the stages of development and all the things that go with it. Is birth weight an indication?
It can be if your mother had gestational diabetes when she was pregnant with you, then you have more risk of getting diabetes later and more risk of being overweight, over 8 pounds. So the babies that their mothers have diabetes, it's usually just people that have diabetes before they're pregnant, but gestational diabetes can cause it too, is that the baby tends to accumulate abdominal fat. So you've got a little baby with a big belly, and then they're at risk to get diabetes later also, not just because their mother had diabetes, but because of the effect of the mother's uterus on them, the placenta, getting sugar poured into them. They tend to have to make more insulin to keep their blood sugar normal.
Now, as people age, though, and get older, is the BMI, is that an indication of potential?
Yeah, the ratio of your weight to your height. So you usually get shorter as you get older. So the BMI usually goes up.
Right.
But the BMI sometimes creeps up when you're older. Also, your pancreas gets older, so it's not able to do what it used to do, with the insulin. So that's another indication that you should watch out for diabetes, especially because most people think of their parents or grandparents, they got diabetes when they're older, but that's why we're talking about pre-diabetes now, because that can go on for years and years before diabetes, and it's a warning sign. A lot of women that have had pre-diabetes or insulin resistance before menopause, after menopause, tend to have problems with their blood sugar, especially if they don't take any estrogen. Women that don't take estrogen replacement after menopause have more diabetes. So they think it's related to losing estrogen, your metabolic rate changes, and you tend to accumulate body fat in the middle.
So is there any type of either treatment or supplement that helps the pancreas?
Well, I said the metformin helps the pancreas not have to make as much insulin. There's other medications that are used for diabetes that help insulin resistance and that swing in the blood sugar. Byetta, Victoza, or shots. Januvia may help the sugar not go up and down as much. There's even the new ones that pull sugar out of your body that actually may help prediabetes, but they haven't done any studies with prediabetes in these medications, but they have promised that they can help prevent a lot of problems with your pancreas later.
Is are sleep issues something that can be a pre-diabetic symptom as well?
Well, getting up at night to go to the bathroom, for sure.
Mm-hmm.
Also, people that have sleep apnea are more at risk for diabetes, probably because of the weight.
If you want to find out more, you go online to beachdoctor.com for diabetes endocrinology. I usually say that right. Diabetes endocrinology consultants and Sugar Talk with Dr. K. Gene Lucas every Monday morning. We'll see you next week.
Thanks.